Before we start off, so let me start off by actually thanking you for being here. Otherwise, it would have just been the speakers and me. Um, how many of you see glaucoma patients as a routine? Just raise your hands. Okay. So a lot of us are being bombarded in meetings with little small messages saying that AI is actually going to take over the role of the glaucoma specialist very soon. And my role of today's instruction course is just to emphasize that that may happen, but we are not going to be around to see that change happening. And in the meantime, it's good to have this information going in through one ear and out through the other, and still focus on what we have been trained to do, examine a patient in the clinical perspective, because decision making is always clinical in medicine. Even if AI comes in, it will only support you. And I'll give you an example. For example, optic disc, as first described by Amli in 1969, a cup disc ratio more than 0.6 was supposed to be suggestive of a glaucoma. They even defined this statistically, saying that if you see an optic disc where the cup disc ratio is likely to be 97.5 percentile of a normal population, then the likelihood of glaucoma is very, very high. Now, this is what AI will do, this is what mathematics and researchers will do. But it doesn't mean, because there will be an odd case which will not fulfill these criteria. And when we are in practice, we are responsible to the individual patient. People who do research, who lead epidemiological studies are responsible for larger populations. And therefore, they have to base their decision making on different criteria. But we are here as clinicians, and therefore we need to focus on the individual patients. Let me give you an example. How many of you have pizzas or make pizzas at home? So do you have when you're making the pizza, do you have a problem in getting the cheese to stick to the pizza? No. So AI, some people had this problem and put this question to AI. And this man said, I'm unable to get the cheese to stick to the pizza. AI suggested, and this is documented, that you use a non-toxic glue to get the cheese to stick to the pizza. I'll give you another question, what intelligence AI has. How many rocks should a child eat per day? Can anybody answer that? How many rocks, pieces of rocks, should a child eat per day? Now, based on some data that rocks are sources of minerals, and minerals are essential for children, the AI suggested that 2 to 3 small rocks per day, and that these should be camouflaged in chocolate and ice cream so that children are forced to take it. So this is AI intelligence as of now. Things will change, but I think it's going to be some time. So I think we're more or less ready to start off. So let me just, we are a small compact group. We'll try to focus more on interaction, but we'll keep the interaction once the speakers have finished. We have tried to keep this very practical. The format remains the same, a couple of case discussions, and followed by a small talk which will give the practical aspects of that discussion. If you have any points, please bring them up once the formal talks are over. So let me just, let me start from this side because he's the president of the Glaucoma Society of India, Dr. Satyan from Coimbatore. We have Dr. Preeti Kamdar from Bombay, Dr. Ronnie George from Chennai, Dr. Mayuri from Ahmedabad. I have two colleagues here, Dr. Divya Raj Srinivasan from Gurgaon and Dr. Jyotsna Jareda from Gurgaon. And I've